everyone. Welcome once again to another webinar from the Eblity series. Today, we'll be talking about intellectual disability, causes and interventions for parents and professionals with Mrs. Geetha Gopi, who is a rehabilitation practitioner and psychologist. She is also the director of Sashaktikaran Trust, but more about her later. Thank you so much for joining us today. It is really overwhelming that people from 25 different countries are joining us today, or rather, more than 25 countries. It is just for keeping account. Thank you so much, everyone. So, before I proceed further, I would like to introduce or talk about Eblity a little bit. What is Eblity? Well, we are an organization for whom you all, that is, the carers of children with special needs, the therapists, the special educators, and the parents, all of you are at the center of our universe. Our mission is to make things easier for you. And one way that we have been thinking of doing that is through technology. Every child wants to thrive, and every child should be able to thrive. And while we believe that technology could help a lot, we definitely know that without the caregivers, technology is insufficient. And therefore, we bring to you the Eblity community, because no caregiver should have to do this alone. We bring to you a community along with other resources to enable the best chance of the child of discovering the child's true potential. And talking about community, of the many multiple ways that we are doing, including WhatsApp, Facebook, Telegram, one of the ways that we bring to you the resources is also through our YouTube channel. You can find over 100 useful videos from this channel. So if you haven't subscribed to this channel as of yet, please go to youtube.com, search for Eblity, and do subscribe to this channel so that you can stay posted about all our upcoming videos and help the child in the best possible manner. Apart from that, we also have our Facebook page and presence. You could follow the page to stay updated at www.facebook.com/Eblity. Thousands of people are already following it. For you all would definitely add more value to it by adding on to the community experience. So do have a look. And without further ado, the speaker for the day, Geetha Gopi ji, so let me introduce her a bit. She has over 30 years of experience of working for children with special needs. Presently, like I already mentioned, she's the director of professional development and programs at the Sashaktikaran Trust, Cochin. For more than 15 years, she has worked in international schools. She has intensively worked in curriculum development and adaptations, behavior management, coordinating and promoting best educational practices using UDL principles among staff, and parent counseling have been important aspects of her work experience. She has also launched early academic programs for a bunch of students and the teacher's kit for teaching early English language skills and basic mathematics based on universal desire of learning. So we are really, really privileged to have you here with us, Geetha ji. And thank you so much for joining us today. So without further ado, I would request you to please take over and conduct the session today.
Okay, thank you, Swatiji, for that very elaborate and flattering introduction. Yes, so we'll start this evening. I give a warm welcome. Good afternoon, good evening, wherever you're from, whichever countries you're viewing this webinar from. So thank you all for, being attending this webinar. So without wasting much time, I'll just go into the topic, which is understanding intellectual disabilities. Okay. I hope the screen is visible. Is it, Swatiji?
Yes, it is, Geetha ji.
Okay, okay. Thank you. So we'll start with understanding intellectual disabilities. So key takeaways from this webinar, we are going to look at the definition of intellectual disability, what constitutes this particular category of special needs, some of the causative factors, diagnosis and classification, associated conditions that are commonly seen with intellectual disabilities, and then the way forward or the intervention practices and what it should include. We go by the most widely accepted definitions, which is given by the DSM-5. DSM stands for Diagnosis and Statistical Manual of Mental Health Disorders. So it defines intellectual disabilities as neurodevelopmental disorders with its onset in childhood or the developmental years, which is from 0 to 18 years. It is characterized by intellectual deficits, which means, intellectual or cognitive functions such as reasoning, problem solving, planning, abstract thinking, judgment, academic learning, etc., are affected. Also affected are learning from experience. Along with the intellectual deficits, there's concurrent deficits in adaptive behavior, which adversely affect the concept formation, social skills, as well as practical areas of living. So these three things are very important to constitute intellectual disability. The developmental age, it should happen within the developmental period, intellectual deficit, as well as adaptive behavior deficits. When we come to the causative factors, causes may be primarily, if we look at it, prenatal, that is in pregnancy or before birth, natal, that is during birth, or postnatal, that is after birth. And usually it is seen worldwide that about 1 to 3% of the general population are affected with intellectual disability. And even though there are a lot of causative factors, about 75% of the cases, the causes are not easy to find. Specific reason can be detected only in about 25% of the cases affected. And the risk factors that may lead to intellectual disability are closely linked with the causes itself. So just to give you an understanding of what are the different kinds of causes related to intellectual disabilities, I've just divided this into certain areas. So one would be infections. So it could be any kind of infections which come during the childhood years, even things like mumps, rubella, measles, any kind of tuberculosis, all these infections, if it affects the brain, and causes encephalitis or meningitis, there is a big risk factor of developing intellectual disability. So infections, serious infections which affect the brain can cause this. Chromosomal abnormalities, genetic abnormalities like Down syndrome, which is the most common, Fragile X, and so on. Similar kind of chromosomal abnormalities also can cause intellectual disabilities. Metabolic disorders, as well as nutritional disorders. Metabolic disorders, some of the most common ones are jaundice, like hyperbilirubinemia, where the bilirubin content in the blood increases. That can, when that affects the brain and the system, it can cause intellectual disabilities. Malnutrition, extreme malnutrition can also cause deficit, doesn't allow the brain, the nervous system to develop as it should, and therefore can cause ID. Toxins or trauma, consumption of alcohol or drug abuse by the by the mother, especially even toxins like chemical releases into the air. These kind of things can also cause issues. Injuries, head injury, postnatally again, serious head injuries which has affected the brain cells or damaged some of the cells can result in intellectual disability. Trauma and toxins. Trauma can also be during pregnancy if the mother's had a fall or there has been some extreme emotional stress they have gone through. Again, these can have effects on the fetus and therefore could be a cause of intellectual disability. Environmental causes, things like extreme pesticide use, which enters the food, and therefore when such food is consumed, that can affect. Tobacco smoke, not just direct smoking by the mother, but even passive smoking can affect. There have also been instances where there have been gas leaks in certain cities, etc. And research has shown that those kind of chemical releases into the environment has also produced generations of children who have different kinds of disabilities, including intellectual disability. And then the biggest main fact, almost in 75% of the cases, it's pretty unexplained. No specific reason has been seen or found. So when we know all these causes, these are the ways we can also try and prevent intellectual disability. So, knowing the causes helps us to identify the risk factors and therefore try and prevent, good prenatal, natal, and postnatal care can help prevent these kind of disabilities. Diagnosing ID. Usually, what we do is take a detailed case history, proper medical history, developmental history, school history, etc. So basically collect a lot of background information from caregivers, from the school environment, from parents, from significant others who are involved with the child, etc. Intellectual functioning and mental abilities that are measured by IQ tests, that is done so that the tests, give an IQ score and we know whether it falls within the accepted average range or below average range. So if it falls below average range, that is when we say, there is a possibility. The tests used to measure IQ, but must be standardized test and culturally appropriate. So otherwise, it doesn't give a proper score. Similarly, occurring because adaptive behavior deficits also occur concurrently with intellectual deficits, these also have to be measured using standardized and culturally appropriate adaptive behavior scales. And usually the score results in what is denoted as SQ or social quotient. So in a person with ID or in a child with ID, usually there's a high correlation between the IQ and the SQ. So both would be below average for the child to be diagnosed with intellectual disabilities. However, with the DSM-5, there is a greater emphasis on adaptive behavior functioning and not so much on the IQ, because even if the IQ is low, with early identification, with early intervention, adaptive behavior deficits can be plugged into, and the children can be made more and more capable and reach their fullest potential. So there's a lot of emphasis now on adaptive behavior function. And what does this include? When we talk about adaptive behaviors, it includes all the kinds of skills that we use in daily living to adapt or adjust to the environmental demands and needs. One of the key adaptive behavior skills is communication. It involves the ability to understand others, to be able to respond to other people. So basically, receiving information from others and giving out information in response, initiating conversation, holding on a conversation, being able to talk at length about a topic, all these constitutes communication. Social skills. Social skills are very closely linked with communication. It involves the ability to interact effectively with others in the environment, So a lot of interpersonal skills, building friendships, understanding the rules of how to make friends and keep friends, etc. Complying with social rules, customs, behaving appropriately in public forum, etc. All these form part of social skills. Personal independence at home or in community settings. So this refers to, if you start from the child himself or herself, ability to take care of yourself. It includes ADL or activities of daily living, that is self-care skills, which involves, right from eating, drinking to toileting, dressing, grooming, etc. The ability to safely complete day-to-day activities or tasks such as cooking, washing, operating electrical appliances, etc., without a lot of guidance or prompts. Performing routine activities in the community, such as attending school, being able to use public transportation, going to the nearby shop, shopping for groceries, all kinds of things that we perform within as activities that we perform in the community. Apart from this, school or work functioning, skills that are required to function in school as well as in the work situation. So it involves the ability to learn new knowledge and skills, be able to apply this knowledge and skills in practical situations without excessive direction or guidance from others. It also includes the ability to conform to the social standards, that acceptable norms of social behaviors that is required in a workplace or in a school or in any other kind of environment. Say, for example, if you're attending a wedding or a public function, to behave appropriately there. So these kind of functioning in school, work, or similar kind of community settings is very important. So all these include adaptive behavior functioning, and the children with ID have difficulties in these areas. Once we diagnose, the disability which if the child has both adaptive behavior deficits which fall below average range as well as intellectual deficits which follow below average range, then definitely depending on the scores we give a kind of classification of ID. Mild, where the IQ ranges from 50 to 69, and adaptive behavior implications are many of these children with training can live reasonably independently with minimum levels of support. They may require intermittent support, especially during transition stages. That is, if they are moving from a preschool to a proper school setting or from a school setting to a work setting and so on. With the right kind of training, many of them can be mainstreamed pretty well within the community. Moderate level of ID, that is IQ ranging from 36 to 49. And if you look at the adaptive behavior levels, independent levels can be achieved, but slightly more levels of moderate levels of support would be needed. They may not always be able to live as independently as a mild category, but many of them do make it in, say, places like group homes and so on. And they would require some kind of support in daily living situations. So they may not become totally independent or almost minimally independent. They may require more levels of support. Severe category, which is IQ between 20 to 35, requires assistance with self-care and safety supervision and so on. So with everyday daily living activities, they require more extensive support and which is many of these children may require 24-hour care, would require extensive, not just extensive, almost pervasive support for every aspect of daily living. So depending on where the child falls in the classification, different levels of support are needed for their daily living. And the kind of training will also have to be geared towards that. In very young children where IQ cannot be assessed, the term global developmental delay or GDD is used instead of intellectual disability. And usually developmental scales which measure different domains of child development are used to assess the child's level of functioning. And if there is, global developmental delay, that means developmental delay which is pretty much uniformly seen in all domains, then this is an indicator that later on this child may be at a strong, there may be a strong risk factor for developing intellectual disability. So when there is a developmental delay, that is the first indicator, whether it is motor milestones, whether it is social skills, whether it is communication, speech and language skills, or whether it is just cognitive skills, understanding things around them. All these developmental milestones are clear indicators of whether the child is at risk or not. So if there is a delay in developmental milestones, that is the first indicator to take the child for a proper assessment. And, at that point, the child may not be labeled as this diagnosis or that diagnosis. But if there is a delay, intervention or stimulation has to be provided right from the beginning. Sometimes developmental delay may not have been set in. In conditions like Down syndrome, when the child is born itself, the clinical features give away the fact that the child has Down syndrome, and we know with Down syndrome they have, they have this risk factor. So right then, they are sent in for further assessment to confirm whether the child has Down syndrome, and if so, then the early infant stimulation starts right from there. So, in certain cases where early diagnosis, as early as newborns, can be done, right from then onwards, early infant stimulation is carried out so that the developmental delay, even before the developmental delay has set in. And, a lot of the stimulation can help arrest or minimize the delay that might set in later. Some of the conditions that are associated with intellectual disability, cerebral palsy is one, CP as it is popularly known. Children with CP, they may not always have intellectual disability, but some of them do. So if they have CP with ID, and the CP issues also compound the problem. So with CP, many of the children do have difficulty with motor control and movement and motor coordination. So they will need additional therapies to deal with these issues. Other associated conditions such as seizures or epilepsy are commonly called fits, and each time fits or seizures occur, there is considerable brain damage. So it is important that if the child has epilepsy or seizures, the appropriate medical intervention has to be taken. And medical intervention or medication has to be continued and monitored very carefully through the, by consulting appropriate medical professionals. Because controlling seizures is very vital to minimizing the brain damage. Other associated conditions are autism spectrum disorder. Again, you do have, in autism spectrum, you do have children who may not have intellectual disability. There is also a sizable number of children who are on the spectrum who do have intellectual deficits as well. And so in such cases, they bring in all the characteristics that is associated with the autism spectrum, which is communication problems, poor social skills, poor eye contact, sensory issues, behavioral issues that arise because of all this, inappropriate expression of emotions, being indifferent to the environment around them, etc. So all the characteristics that are associated with autism spectrum may also add on to whatever difficulties they already have. Other associated conditions could be, you may have children who have intellectual disability but with visual impairment or with hearing impairment. Sometimes all three may occur. So the multiple disabilities may be present. So whenever there is an associated condition, the important thing is to identify those and take appropriate intervention to handle the challenges posed by the associated conditions as well. So what does effective intervention include? First and foremost is early identification. So as early as possible. Even with the prenatal screening, and nowadays when mothers are expecting, there is a lot of scans and blood tests and other things that are taken in. So prenatal checkups are very important. Maternal health is very important. Maternal nutrition is very important. And if there are any pitfalls in these areas, there could be risk factors. So taking care of that. Early identification can also mean that if there is any kind of detection prenatally, and if there are medical interventions that can be done to correct those, that can be done. Especially, one common thing is where there is RH incompatibility. Sometimes with blood disorders, if the mother is RH positive and the fetus is RH negative, RH incompatibility in the blood group can result in complications which may lead to intellectual disability. So this can be easily noticed in prenatal period, and corrective measures can be put in place. So early identification means it could be in the prenatal period. Sometimes prenatally things would have gone fine, but maybe there were problems during delivery, during birth. So if there are issues, then right then, the child has to be monitored. Early identification can also happen with, when you're doing pediatric checkups, especially nowadays in most of the government hospitals and medical centers, when the children are taken for immunization, and there are periodic pediatric checkups. These kind of things are monitored, and so early identification is possible. All district hospitals nowadays have early intervention centers. So again, if there is a developmental delay or a risk factor for a developmental delay, children can be taken to these places, and early identification can be done. Once early identification is done, appropriate placement in the right kind of stimulation or intervention programs can be done. So again, appropriate placement has to be reviewed from time to time, from when the problem is identified to, as the child grows, as the child progresses, placement options also have to be reviewed and revisited. And then holistic management. So wherever whether it is early identification and appropriate placement, whatever therapies or whatever training programs or skill development programs you're giving, it has to take into account all possible areas that the child has difficulties or challenges in. And therefore, holistic management is very, very important. So for effective intervention, all three areas have to be taken into account, and then only effective intervention is possible. So what are the different kinds of intervention or stimulation programs that children may need? One is special education. Again, if they're identified very early, early intervention will comprise of all these areas. So even if they are newborns, or even within 0 to 3 years, all these different areas and their inputs have to be taken into account when we are planning intervention programs. So special education is one area where a lot of emphasis is placed on skill training and to minimize the deficits in adaptive behavior. So to build up more positive behaviors, more to bring the children back into as much as possible into mainstream developmental patterns. Parent counseling, and this again takes, it's a process that goes on for several years, over several sessions, because at each stage, the parents need to be counseled on what is necessary for the child, what is most beneficial, whether a particular intervention has to be carried on for a long time or has to be stopped, whether the placement has to be revisited, or the child has to be moved from, say, an early intervention program into a preschool program, or maybe from a regular school to a special school, or to or from a or the child may need something totally different, such as a part-time special school and part-time regular school setting. So for all this, taking the parents into confidence, making them aware is very important. Third, social skills and life skills training. Because these children have intellectual deficits and adaptive behavior deficits, they do have limitations in in how far they can achieve skills and goals. By that, we don't mean to limit the children. We definitely need to work towards helping them achieve their fullest potential. But we have to remember that everything that we teach, they may not be able to apply it in practical situations. So therefore, to minimize this problem of maintaining the skills that they've learned over a long period of time, as well as generalizing it onto different environments, different situations, as the environment may demand. The training that we give has to be very life skill oriented. So even if it is academic skills, it has to have a functional component to it so that we can minimize the problems that these children face with regard to maintenance and generalization of skills learned in school or classroom or therapy situations. Sensory integration training, especially if they have autism spectrum as well as intellectual disability, there may be sensory issues. Even otherwise, sensory imbalances may be there, and especially with early intervention, sensory motor coordination and integration is very important. So, including elements of sensory integration into your therapy programs or the activities you choose are very important. Therapies, different kinds of therapies, depending on the challenges posed by the child: speech therapy, occupational therapy, physiotherapy, and so on. It can also include things like music therapy. Nowadays we even have things like theatrics and drama therapy, etc. So a lot of different kinds of therapies, whatever will help the child to blossom as an individual and provide them with a wider arena of skills to become more adapted into their environment, can be made use of. Medical intervention, especially in cases of seizures or if there are other medical conditions that the child has which requires medications, definitely that has to go hand in hand. Assistive technology, again, with the children with intellectual disabilities, nowadays technology is very advanced. If they have issues with, especially if they have issues with CP and intellectual disabilities for locomotor functions, they may need assistive technology. For learning, they may need a lot of audiovisual media to help them understand concepts and so on. So assistive technology can play a big role in reaching out to children and persons with intellectual disabilities. Last but not the least, accommodations and modifications with regard to the environment that they are living in, with regard to the learning aids that they require, with regard to the school environment, whether it's the academic area or the behavioral area, the language which we use to converse with the children. So the classroom environment or the work environment, wherever the child is facing challenges, you may need to accommodate and modify things to make their life easier and to help them become better adapted individuals. A lot of concerns and questions that are asked of us as professionals by parents is how far can these children proceed academically. So, especially if we talk about India, now we have the Right to Education Act, the RTE Act, and the Rights of Persons with Disabilities Act, RPWD Act. And with the implementation of these acts, many of the children with ID, especially those who are in the mild to moderate category, are being included in regular schools. Many of them are attending regular schools. But having said that, inclusion is very good. It helps build a lot of skills. It gives them a lot of exposure. It helps the community, learn more about the children with the ID, and therefore be more compassionate and more empathetic and supportive of them. But having said that, certain other things need to also be put in place to make inclusion very effective. So, for effective inclusion, just including them in regular settings or regular schools is not enough. What we have to back it up with is adequate special education support. And many of them, if intervened early, if the right kind of support systems are given, most of them manage to learn key primary level academic skills. If not all of them, but at least a major part of reading, writing, basic math. Many of them can be helped. Once they move into middle school, high school, and as concepts start getting more abstract and more difficult, children with ID do have to face difficulties. And you have to, as professionals, as parents, rethink whether the academics they are learning is going to be useful for them in the long run. So, if they are not going to be useful, then we need to make way for more functional academics. And functional academics is a huge area where it involves reading, language, literacy, maths, etc. But everything has a life skill connotation to it. So, academics which will be useful in the child's present or possible future living environments. And then after the schooling years, once the child is slowly entering teenage and moving into adulthood, ensure a smooth transition. So from say a school setting to a pre-vocational or a vocational setting. And for the smooth transition to take place, it is not enough to just wait until the middle school years or when the child is, chronologically, age-wise ready for a pre-vocational or vocational setting. This transition has to be built in with a long-term vision right from primary onwards or even earlier. So functionality of all skills that are being taught or imparted to the student is very important to help the child move seamlessly from a school to a pre-vocational or vocational setting. So when we talk about functional skill development, what are we talking about? We're talking about language and literacy, which is speaking and listening. Again, public speaking, taking up phone calls, messages, calling up people when you're sick, if you're attending a work situation. So a lot of social behaviors that involves taking directions, giving directions, following things in a time-bound manner, being able to complete a certain job in within a fixed deadline, and so on. Functional reading, being able to read important words, signs in public places, names of products, reading if they do not develop the regular primary level reading, at least being able to read important things that they would need to function in the community. Writing also, if they are unable to develop self expressive writing to a great degree, at least some functional writing, if possible, such as signing or filling up an application form, or at least some minimal things have to be taught. So functional literacy is very, very important. Functional maths. Here again, we are not talking about book related academic maths. We are talking more about commercial maths or life skill based maths, which includes money handling, managing time, budgeting, being able to keep accounts, at least being able to do some amount of banking, keeping, being aware of the timing of public transport system if they're using one, and so on. EVS or environmental studies, science, social studies related topics, general knowledge about the environment they're living in, basic safety skills, especially personal safety. Nowadays there's a lot of talk about sexual abuse, etc. So, personal safety is a very, very important topic to be taught to these children. Safety in public places, using public transportation, using things like household appliances, electrical gadgets, etc. Being aware of health, hygiene, basic first aid, all this is very important, and these things, life skills, need to be taught to these children. Domestic skills, which involves cooking, cleaning, housekeeping, use of household gadgets, appliances, etc., how to use them safely in an appropriate manner. All these things have to be taught. Hobbies. Now, this is something a lot of professionals, parents tend to ignore. This is also equally important as the other skills. As per the interests and the aptitudes of children, they can take up any kind of hobby or hobbies, because that adds a much more colorful dimension. It helps them to utilize their leisure time productively, appropriately, and it adds on a completely different aspect to their personality development. So basically, being functional skill development should take care of all these different aspects of skills, and training has to be imparted right from the beginning in all these areas, so that they can have a more fuller, more complete life, just as like any of us. Some of the tools that can be used for can be used for assessment, as well as can be used for program planning. And since I'm from India, I'm mostly talking about the ones that are widely used in India. One is the MDPS, or Madras Developmental Programming System, which is brought out by the Vijay Human Services, Chennai. Behavioral assessment scales for Indian children, basic MR, which is by NIPID. NIPID is the National Institute for Empowerment of Persons with Intellectual Disabilities, based in Secunderabad, India, which has regional centers in Delhi, Kolkata, and Bombay as well, Mumbai as well. Functional Assessment Checklist for Programming, FACP, by NIPID again. Behavioral Assessment Scale for Adult Living, BASIL, by NIPID. Vocational Assessment Programming System, VAPS, by NIPID. And these are different scales used at different age levels for skill development and adaptive behavior development. So very good tools which are used extensively. All you have to do is to go to the NIPID website, and you can find these and use them to the best possible effect to bring out the best in these children. So that brings us to an end of the topic. Thank you all for being patient listeners. I think we can go into the question answer session now. Swati ji. Swati ji.
Hi, Geetha, Gopi.
Yeah.
1 second, let me.
Hi.
I think Swati might be. 1 second.
Yeah.
Hi, Geetha ji, can you give me back the host rights? I'm unable to turn on my video.
Okay, so I still go to participants, right?
Right.
Yeah.
Apologies, dear listeners, for this technical glitch. Just a moment and we'll be back. By the way, it was such an amazing experience listening to you every time. Having a conversation with you is so enriching, so fulfilling. And I hope the experience was likewise for each of our attendees today as well. It was really, really informative.
Give me a direction on where to go, Swati. I just...
You just need to click on more and make me the host again.
Yeah, okay. Well, more says stop live stream. It doesn't give other options.
No worries. So let us go with this. I think so. What I need to do is just to be able to talk to you. Our listeners just need to hear you and watch you while you share your very valuable knowledge with all of them. So a lot of questions have come to us, Geetha ji, today from all the participants. And some of the most common ones are the ones that I'll be picking today for the Q&A session. So for the first one, I know that you did elaborate this in your presentation as well, but still, a lot of people have confusion as to how to differentiate between intellectual disability, autism spectrum disorder, borderline intellectual functioning, and learning disabilities. So, if you could differentiate between all these four terminologies for our listeners today.
Yeah. Yes. This is a very commonly asked question actually. What again, we have to go back to what defines these conditions. So when I'll just going back to ID. In ID, definitely you have to go into the IQ testing and the adaptive behavior deficit testing. So the three things that were mentioned in the definition. Developmental period should occur during the developmental period. The IQ should be 69 and below. That is, anywhere below 70 is considered below average IQ. And adaptive behavior deficits also, which are lying close to 70 and below, 69 and below. So if the SQ and the IQ falls between below the average range, you can safely say the diagnosis is ID. Again, we have to take into account the age of the child. And nowadays, the trend is generally not to label the child immediately, because sometimes you may never know, the child may not have had exposure. Okay, so it is important, even after you assess, give an intervention program, monitor the child for at least 6 months, and see whether the child is progressing, and do a reassessment to see whether the child stays within that below average range or is moving out of it. So this is called response to intervention. So I would suggest, don't go in for diagnosing, especially in the early years. Diagnosis should only be to detect what the difficulties are and what should be done next, not so much to find a label. When children with if there are children with autism issues, the behaviors itself are a good indicator. There'll be a lot of these characteristics, as communication issues, social issues, sensory issues, eye contact, or sometimes, with the autistic children, they have repetitive self-stimulatory behaviors. Many of these issues may be present. And there are, for autism, again, there are different scales, rating scales that are used to detect whether the child is on the spectrum or not. So when suppose a child comes to us with, with autism spectrum characteristics, if it is possible for such children to have an IQ done, we can do it, but it is very difficult. Usually we find children who have ID and ASD, it may be difficult to do it in, say, a few initial assessment sessions. It may take, what we usually do is we do whatever initial assessment is possible. Based on that, start an intervention program, and as we get to know the child more and more, and better rapport is established and so on, then we move on to see whether intellectual deficit is there or not. And usually when you work with the child for a considerable amount of time, in different ways, you get an indication of what their cognitive level of functioning is. You don't really have to, you don't need an IQ number to denote that. So that is thing. Borderline intelligence is, normally there's no such technical term called borderline. Nowadays, we don't generally use this term. It's usually called near average. So that usually is from, say, 85 to IQ to, say, 70, where the child is not going into below average, but is not in the average range either. It's slightly below, it's in between. That is what is normally denoted as borderline intelligence. LD is a completely different condition. In specific learning disorder, what happens is the IQ will be average, below average, or in some cases near average. And but adaptive behavior deficits may not be very pronounced. So that is a very, very clear indicator. And besides, even talking to a child with SLD, you will know how well their cognitive skills are. And usually parents will say, oh, the child is fine in all the other aspects. It's only when it comes to academic learning or attention or something that is very closely linked with academic learning that the child has difficulties. So this is how you can kind of differentiate between these conditions. Basically, we do these standardized tests, but as I said, sometimes children may not have had exposure and so on. So it is very difficult it is not preferable to give a label right at the beginning.
Right.
Unless there is a clear cut, unless there's a real clear cut, the scores really clearly indicate, yes, the child has this issue. And as I said, with younger children, we don't say ID at that stage. We just say global developmental delay and work on from there to plug in the developmental delays.
Right. Hope this does clear the confusion many of our attendees today had. Right. A lot of people have also asked us if the impact of intellectual disabilities increase or decrease with age. So if you could answer that for us.
Normally they say it doesn't, but having said that, because of training and intervention given, the IQ scores may go plus or minus 5, sometimes even plus or minus 10. And depending on how effectively the child gets intervention and so on. So the thing is, like, sometimes a child with a moderate level of ID with the early intervention and the right kind of support systems, later on when you assess them, they may move on to mild. And we've also had children who have been on the mild thing, later on at some point, at least the adaptive behavior part of it, may not be the IQ part of it, but at least adaptive behavior wise, they improve so much with the right kind of support systems and intervention that it is very difficult to make out that they have ID. We personally have had such children coming to us. I mean, there have been children who've been coming to us for disability certification for board exams. And, their adaptive behavior is so good and they are so much almost on par or close to their peer. It is only mainly when it level functioning where a lot of problem solving or reasoning, they seem to have, seem to be doing.
Hello?
Hello?
Geetha, if you could repeat the last line, there was some network glitch. We couldn't hear the last line very clearly.
Oh, okay. I was talking about the children who, with the right amount of early intervention and right kind of therapies, intervention and support, they can move from the severity of the disability can improve, go from a moderate to a mild, for example. Or sometimes even mild children with mild ID, if not the IQ very much, but at least the adaptive behavior can be improved to a great extent. We ourselves in our clinic have had experience with children who come to us in the high school ages, if they're going to appear for the board exams for disability certification. And we find that the IQ is, yes, below 70, but because they've received intervention right from their early ages and because they have adapted so well, the adaptive behavior skills have come up really high. And it becomes, it is a very tricky thing, actually. You might almost think they are, having a SLD. Because in SLD, that's what happens. They are, their other behaviors are fine. But again, having said that, they may have some deficits when it comes to higher level cognition. Understanding abstract concepts, problem solving, if there's a sudden situation to be able to take those instant decisions. This is where you can actually differentiate a child with ID and a child with SLD.
Sure, sure. Every speaker that I have been speaking to during these past webinars has emphasized so much on the importance of early intervention. I hope that the awareness about early intervention reaches far and wide. And Eblity webinar series is actually one of the efforts to spread this awareness so that we can help more and more children especially. We can help them early. And if you wish to join, dear listeners and attendees, if you wish to join the next webinar from the Ability series, you could which is happening on the 27th of this month, and it would be on the topic importance of motor skills for the development of children. Our team members would be sharing the link of the webinar, the registration page link of the webinar, in the chat box shortly. So if you would like to attend that webinar, please do register. But coming back to the amazing Q&A session that we were having with Geetha ji, you were just talking about, academic skills, adaptive skills. I have another question related to that. A lot of participants today have actually asked it. What should we focus on more? Academic skills or daily living skills for children with intellectual disabilities? What do you suggest is more important?
It should be both, but the creativity lies in how well can you marry the academic skills with daily living skills. For example, I can just give an example. For example, if you're teaching number concept to the child, you can do it in a school situation where you're doing it with paper, pencil, but remember, these children do have difficulties with generalization. What they learn in one situation, they may not easily apply it into a practical situation. So it is very important to do the practicality part of it side by side. So normally what I say is, okay, in a school situation or in a clinical situation, we may be teaching them using counters and so on. But translate that into life skills at home. So for example, if there are 5 members in the family and we are teaching them number concepts, so I would tell them to count how many family members are there and count an equal number of plates or glasses to set the table for dinner. So here you're setting the table for dinner, which is a domestic skill. You're using number concept there. The child is also becoming, having social skills because the child has to move around, go around, count everybody, interact with people. So this is how you can bring about, how you can integrate practicality and functionality of skills into whatever you're teaching. And that is very, very important, particularly with children who have intellectual disabilities, because they do not always easily translate what they learn in an academic situation into a life situation. So it is very important that we build in that life skill component while we are teaching academics.
Such an amazing idea and response to the answer. Marrying academic skills and daily living skills is really important. I hope all our attendees do note this takeaway and very important takeaway from you. A lot of people have also asked us, Geetha ji, what is your advice if they should send children to inclusive schools or special schools, and which one is better, especially for children with intellectual disabilities?
There's no hard and fast answer to that. We want all children to be included, but we have to again view inclusion in a long-term perspective. So long-term perspective means ultimate goal of inclusion is to be included as a productive, earning, socially adapted member of the community in adulthood, right? So for that, whatever it takes, we have to do. If they enter regular schools, if they're ready for entering regular schools with support, so be it. But as I said, it doesn't mean that once a child enters a regular school, that child has to remain there all their life. We have to revisit, review their placement options, the kind of services they are receiving, the kind of progress they are making, and see whether the child is benefiting from that environment or not. So ultimately, as I said, the ultimate goal of inclusion is to become a member in the community, just like any of us. So for that, if for some time, some children, what happens with some children is they may, in the early classes, they may be fine in an inclusive regular setting. But maybe as the academics get higher up and get more and more difficult, it would not be pointless keeping them in a regular school with regular curriculum. So the ideal part, the ideal situation would be within the regular school if they get curriculum modifications. Or sometimes, now that is not always practical in a country like ours. I know of parents who I have suggested that, because sometimes our regular and special schools are very, they have clear demarcations. So I have suggested to parents where they, for the academics, they probably go to a special school, and for the social integration and peer participation, development of co-curricular and extracurricular activities and so on, they go to a regular school. So there are children who go half day to a regular school and half day to a special school, or they may go twice in a week to a regular school and the other days to a special school. So it depends from child to child what the child needs, and it also depends from each stage of development. So it has to be reviewed. Ideally, review it every year, see whether it is benefiting the child. If not, should the placement be revisited and relooked at? And also vice versa. Some children start off in a special school initially because they are not ready for a regular school, and then later on when their social skills or communication skills built up to a certain extent, then they are ready to be included. So it depends. And some children may come from a special school to a regular school and then go back to a special school when it comes to high school. So it depends on each stage of development, where the child is, what are the challenges they're facing. Basically, the most important thing to realize is that the child needs to be in the most enabling environment. The most enabling environment. That is the key word here. So at that time, what is the most enabling environment? That needs to be taken into account. And again, have a long vision. Ultimately, this is where the child needs to move into. So keeping that as a final target goal, one has to look at placements, and it should be fluid. There's no rigid placements.
Definitely. Wow, wonderful. There's no right or wrong answer. You need to continuously review and assess. And like Geetha ji suggested, the child should be in the most enabling environment. Great. And while we are talking about education system, I have another question related to it. So what are the provisions available in our education system for children with intellectual disabilities, and how does it help them? If you could throw some light on this.
Different boards have different provisions. So if it is the state board, I think different state boards have their own set of provisions that are provided. Speaking from the state of Kerala, the Kerala State Board of Education has, they provide a scribe or an interpreter. They give grace marks. I think they give a certain amount of grace marks. So if they write the exam for a certain amount of marks, the grace marks are added on, and they can get through the examination. CBSE has a lot of these benefits. They give extra time. Provision of a scribe is given. Interpreter. If you go into each of these board websites, they usually have listed out what are the different provisions that are available. CBSE also gives subject drop option and so on. So you can actually, for every board, because it's slightly different, one can go, whichever board the child is being put into, you can actually go to those board websites and find out what is available. And all that is available need not be taken up also. It depends on what the child needs. So whatever is available and whatever the child needs, tally that and choose whatever provisions will be most beneficial for the child.
Great. So a lot of attendees who are watching us live on the Zoom platform are asking us that from what age can we do the IQ test, and if there are any interventions that you could highlight to increase the IQ of children.
Um, IQ test normally nowadays, I think they say 8 years, not below 8 years, you don't do IQ tests. So only after 8 years. But having said that, if you have children with ID, you know they are delayed. So when we say 8 years, we are talking about kind of average children. So if a child of 8 years who probably has ID comes to you, that child's level may not even be 8 year mentally. Mental age may not be 8 years. So sometimes it is advisable not to do IQ till much later. Maybe give another 2 or 3 years time. And again, as I said, the IQ is just a number. It should only be at the back of our mind, not in the front of our minds. And one shouldn't even look at increasing IQ, because what one needs to look at is look at adaptive behaviors. Once you develop those adaptive behaviors, you will find when you do the IQ, the points would have increased somewhat.
Right. Okay. So these were some questions from the parents, I believe. A lot of educators who are attending this webinar today have been asking us that how can they help other neurotypical children to practice empathy in dealing with kids with special needs like intellectual disability.
I think it starts from home. If as parents you encourage children to, actually include these children in play, in your community functions, in the school, etc. Children need not be. You can teach them through videos and all different kinds of activities. But the best thing comes from parents or the home environment or in the school environment. What is that the school or the parent or the home environment is projecting? If the parents do it, the children will follow. If the school teachers, the management does it, the children will definitely follow. So it is creating that kind of environment. And also, in inclusive settings, many of the children with special needs are interacting with regular children and participating alongside them in functions, in cultural activities, sporting activities, academic activities, etc. So that even because of the fact that they are together, they learn more about each other. Both the child with special needs learns about the regular children and vice versa. That itself brings about a lot of empathy and compassion and understanding, and that is one of the biggest takeaways in inclusive education.
Wow. Definitely, that is one of the biggest takeaways. And like there's this saying, children imitate way more than they listen. So yeah, they will see what they will do what they see. As much as I enjoy talking to you, Geetha ji, and as much as I enjoy learning more and more from you, due to time limitations, I would, have to end the session. But one last question before I call it off. So, if you could suggest some vocational courses for children with intellectual disabilities and how to develop prerequisite skills required for independent living.
Um, Vocational training courses, many of the some of the government places do have them. Many of the NGOs who are involved in vocational training do have them. But having said that, I have a big issue with the way vocational training happens in the country. What we really need to look at is it's not enough to just give vocational training. They need to be able to find jobs and stay in jobs. So getting employed and staying employed is very, very important, which we find is very, very low when it comes to children with, or persons with intellectual disabilities. So my thing would be work backwards. Find a placement, possible placement, depending on the child's strengths, the child's weaknesses, whatever, taking into account the child's whole persona and interests, etc., and see what are the possible placements. So find a possible placement and work backwards. So find what skills are necessary to get employed there and stay employed. Many of them get employed, but staying employed becomes a problem. So it is, I really do not subscribe to giving them vocational training, which will end up with no jobs. So that is what is happening. Unfortunately, that's a big part of vocational education for children with ID here, and that has to be reversed, and identify the possible placements and work backwards on what skills will be necessary to getting employed in that situation and staying employed, and train the children there. And also, when you give support systems, maybe initially when the child is placed, the child may need a lot of support, and with time you can provide intermittent support and wean off support as well, give. Independent living, again, it's the same thing, find a possible placement. If a lot of times in the Indian setting, because we have joint families or, siblings who are willing to take care of their of persons with ID, we normally find living adult independent living is not as pronounced as it is in the Western countries. But having said that, yes, with nuclear families, this is also becoming an issue. And nowadays, there are places where there are group homes. Uh, in fact, one of my professors from who retired from NIPID, she had once presented in a webinar about how she had trained two adults with Down syndrome uh, in independent living. Both the parents consent. Both the parents of both the persons consented, and they were, given an apartment, and skills were identified. What are the things they required? A lot of the skills they were doing independently, both of them, and some of the skills, yes, they did need supervision, for which they had a part-time or a full-time assistant coming in, a house help coming in. But otherwise, a lot of the things they were doing, and both of them were employed. One of them was actually, if I remember right, he was working in a fine arts place where he was a dance educator. So, it is possible if due attention and care is given to train them, especially with the mild intellectual disabilities.
Great. Making it sound possible sounds so positive to me, and definitely it is possible. I would like to believe that, and I hope all our attendees would like to believe that. And this is why they all are here listening to you, trying to learn more and more as to how to make all of these things possible for their children, for the children they care about. Thank you so much, Geetha ji, for joining us today. It was a fantastic session. We got to learn so much from you today. Thank you so much for joining us. Any
Thank you.
last few
Thank
words that you would like
you.
to say?
Yes, thank you, Eblity. I'm always very, happy to be associated with Eblity because of the thorough professional way in which you conduct all these things. And yes, definitely not many people come forward, to build up this kind of an expertise in special needs. So thank you so much for giving me this platform, and and a big thank you to all the participants who've asked very, very pertinent questions. So always glad to be there as a professional to help in whatever way I can. Thank you.
Thank you